There are a lot of interesting things going on in the field of nephrology. One, recently they transplanted a pig's heart in I think New York or something. So same thing is going on. Like they're working on artificial kidney, so artificial organ, xeno, like coming from another species.
Yeah,
There's some work going on mechanical artificial kidney using nanotechnology. So you will have a kidney this big artificial implanted, so you do not have to go to dialysis center. There are a lot of things uh, going on a cellular level where you can target one cell instead of. So currently, if you give chemotherapy, that goes to
yeah,
all the cells,
yeah,
and that's why all the cells die you lose here.
yeah.
So similarly, they're trying to focus that go on one cell.
What's good, YouTube? Today we will be talking about who nephrologists are and what they do. We have Dr. Mallick with us today, and he is a nephrologist in an educational setting. He has some crazy stories and some very interesting things to tell us. So please stay tuned. Welcome, Dr. Mallick. How are you today?
I'm very good. Thank you very much.
Yep, it's a pleasure to have you here. How about let's start with you introducing yourself.
So my name is Salman Mallick. I am assistant professor at University of Minnesota with Department of Internal Medicine. Um, that's a short introduction.
Okay. So, can you tell us a background about how you got into the medical field and what part of it you are in?
It's a difficult question because when I was growing up, I had interest in science and technology, the STEM fields. Um, but with growing up in a impoverished country, looking a lot of suffering around, and slowly I moved towards choosing internal medicine as a
Okay.
field to give it back to the society.
Okay. So, where did you go to school from?
So I went to Dow Medical College. This is a large. It still is the largest um, medical school in Pakistan.
Okay. So can you elaborate on that experience as well?
So it was a fun time, very learning time. Unlike here, we start after high school, our medical school, so relatively young. So emotionally, uh, you can say not as uh, grown up.
Yep.
So with the course of a humongous course, as you know, medicine um, has uh, the largest or most extensive
Yeah.
syllabus to cover um, in 5 years' time, and seeing the disease process, seeing distressed patients. So those were the challenges. The but as a class, you stay with the same class for the 5 years,
Yep.
so you develop very strong bondings that
Yeah.
last throughout the lifetime.
Yeah. Yeah.
Um, and in our college, there were a lot of charity organizations that students volunteer to, like students run, managed. So that was all those were good experiences.
Yeah. So moving on from that, can you please describe your profession and what you do?
So I'm nephrologist by profession. So what we do is we take care of kidney diseases. Um, so it's interesting how many things a kidney does.
Yeah.
When it's producing urine, it's
Mhm.
taking care of what should be the body balance,
Yeah.
what should be the balance of all the electrolytes, what should be your acid-base balance. Apart from that, how much calcium should deposit in your bones is determined by the kidneys. How much blood the body should make, that's also determined by the kidney. So it's a very basic in organ that does a lot of things. So when we are treating the kidney disease patients, we deal with that. So it's very interesting.
Yeah.
Um, and being nephrologists, we do have dialysis option as well. So like if your heart fails, you don't have much options other than the transplant, but
Yeah.
dialysis, we can keep them on, uh, keep the patient living till they get the transplant. So
Yeah.
in advancement, it's
Yeah.
pretty matured as well. So it's very interesting.
So, as a nephrologist, what problems in the kidney do you see most common?
So right now, the number one cause of kidney disease is diabetes.
Mm.
So as long as we have diabetes, we will continue to see that problem. Um, and personally, I think that we should spend more resources in preventing the diabetes to develop. So like spending more resources to public health, educating the masses to have a better diet, exercise, so they don't develop diabetes, so they don't develop kidney disease.
Okay. So, as a nephrologist, do you diagnose and prescribe medicine, or do you also do like surgery and that other stuff too?
Sure. So as a nephrologist, you mostly do prescribe medication, dialysis, very minor surgeries, like if you have to put a catheter to get the dialysis going. The surgery part of the kidney and the urinary system, those specialists are called the urologists. So they deal with all the surgery. So if we have to do transplant, so it will be the transplant surgeon and the urologist doing the transplant. But
Yep.
once the transplant is done, then we manage their medications.
Okay. Okay. So, since we're talking about all of these things that you do as a nephrologist, what would you say is the most challenging part of your career job?
So the most challenging that I feel is emotionally can be very charged. What do I mean by that is they're young kids with very heavy disease burden. Um, uh, like at 20 years, they have lost their kidney. They come for the dialysis 3 times a week, so they're losing their liberty. So that is very painful. The average life on a dialysis is about 5 years. So you are taking care of a patient, and suddenly you know that Mr. Jones died the other day. So those are the two aspects that I myself uh, challenging. But these are complex diseases, so taking care of them is fun. So
Mhm.
sometimes it's hard to sort out what the patient is, but those are challenges, but fun challenges.
Yeah. So, for diseases of the kidney, are there uh like a few types, or are there many different diseases of the kidney?
There are quite a few. It's and as I told you, it's a very basic organ, so it does take care of many things, like how much blood you have, how much. So all your electrolyte disorders are the nephrologist problem. All your water problem is a nephrologist problem.
Oh, okay, okay.
All the blood not cleaning water is nephrologist problem.
Okay, okay. And for the medication, what type of medication? Are they just pills or are they shots? What type of medications do you give?
Both. So there are pills, there are shots, and there are these new medications, the monoclonal antibodies, uh, where they are working on a cellular level. So
Oh, okay, okay.
all types.
Okay. And how quick do these medicines work?
It totally depends on the disease process. So
Okay, okay.
sometimes, like we give erythropoietin to form the blood, but the kidneys are not able to secrete the erythropoietin. So in that, you give it and the blood starts get producing, as opposed to some systemic diseases. What I mean is the glomerulus portion, your kidney cells um, are attacked by your own body. So
Oh,
for that, the treatment lasts for years.
oh, okay, okay. Well, that's actually crazy. So so now let's uh jump into your your job life. And so how does your work day look like? So if you go into like on a normal day, how does it look like?
Okay. So a normal day will be spent sometime with the residents. I'm at a teaching hospital. It's always fun to transfer the knowledge. So these would be the patients who are in hospital. Um, uh, and their disease could be related to kidney, or they just happen to be dialysis patient who had some other disease. So we spend some time there. Then once a week, we'll have to go to dialysis center to do a monthly review of the patients. Then once a week, we have a clinic where we see your whole patient population at the clinic. And in all settings, the residents are with you, learning. The residents and medical students, they continue
Okay.
to learn. So it's fun.
Yeah. So so you only look at patients once a week?
Uh, in the clinic and in
Oh,
the dialysis center. In the
oh,
hospital, it's almost every day. It's a
oh,
full
okay.
job.
Oh, okay, okay, okay. So how is the workload?
It's okay. So I will speak for myself. It's pretty manageable. Good time off, uh, decent time to spend with the family. Um, Few colleagues that are in private practice. Um, so how should I put it? So, so they can become as busy as they want. But the nature of the work is that we are in short supply of physicians.
Mm,
So it's hard to have a good life, like a life work balance,
mm-hmm.
because there's need is there.
Oh, okay, okay.
So someone has to see those patients.
Mm-hmm. So from your field, how much do professionals make? Especially since they are rare.
So it's variable on your um, type of practice. So if you are in private practice versus if you are in a private hospital versus if you are in teaching hospital. So teaching hospital would be the on the lower end, and the I think the average is about 270 or somewhere around it.
Okay. Oh,
But
that's good.
then
That's
there's a range.
yeah, that's good pay. Yeah. So you said teaching school, private hospital and private clinic. Is that what you said?
A private hospital, a private clinic, or independently owned. So I can own
Mhm.
my practice. I can work for a private group, or I can work for a university. So those are
Okay.
the three.
Okay. Okay. So you work for a university?
Yes.
Oh, okay. So that's why you
So I
were
am
working with.
on the lower one. Yeah,
Oh, okay. So that's why you were working with the medical students and the residents.
there is.
Yeah. Okay. Okay. Oh, okay. 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 Okay, that makes sense. So wait, how many years of experience do you have?
So I have now um, 12 years.
Okay, so that's a lot of years. So what would you tell a person who's trying to get into nephrology?
So, that would be someone who has already done medicine
Mm-hmm,
and who has already done 3 years of general internal medicine.
mm-hmm,
So by that time, he, he would have enough exposure already to choose nephrology or not. But what we say, it's very interesting and
yeah,
a very basic thing. Um, very so so when the patient gets sick, those are the disturbances that happens. Like if you get septic, which is a common problem, you get a bug somewhere, and then slowly you may have heard of septic shock.
yeah,
So, so your acid base will go haywire. Then who will come to rescue? The nephrologist.
yeah,
Um, if you become septic shock, your blood pressure gets very low, your kidney don't get perfused, you get kidney failure. Who is your savior? The nephrologist.
yeah.
So it's very interesting. And the medical students or the residents, they see that and they develop the love of nephrology.
Okay. So a lot of my audience is high schoolers, they or maybe even college students. So what would you tell us high schoolers and college students?
Sure. What I would say that so when I did medical school, right after medical school, I did about 7 years computer programming. And then I moved back to internal medicine. So what I would say, if you want a job that you would love to go, that will provide you a very good uh, job satisfaction that you will love to do every day. The feeling when you treat a person and he gets better
Mm,
is is very hard to compare. When I compare it, when we used to develop a program,
mm.
and after the launch, you get that feeling for 4 or 5 days
Yeah,
that you
yeah,
achieved something.
yeah.
So that feeling, you get that almost every day.
Mm,
So very noble profession and very satisfying.
yeah. Um,
It's one more thing
yeah, go ahead.
I think I should mention. So when I did the computer science thing, every year the technology changes immensely. So you will have to continuously learn. So in medical profession, things change, but like I gave board 10 years back, and last year I gave it again.
Hmm.
So
Yeah,
there's the change is slow. So you
yeah,
can, yeah.
yeah.
So
Um,
when they say that it's a lot of syllabus in the medicine, yes, in the beginning it is, but then it gets easier. As opposed to computer science or others, it's the
yeah,
change is just
yeah, yeah. So you're talking about how it's very satisfactory. Is there like a story that you could share with us high schoolers about like a rewarding experience?
there are many, uh, uh, too many. Um, so there's a patient um, was in a very small town. They were not able to identify the disease. Transferred to the university in pretty bad shape, on dialysis. Um, so much so, so that when your potassium gets high, your heart stops. So it's a so they will need emergent dialysis and like sort out why the so we identified, and the whole family was so thankful
Yeah.
to us, and 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 they used to, so they had a farm, they used to bring the cheese and all that for a
Yeah.
long time to follow.
Yeah.
So this, I mean, it doesn't, in a monetary sense, it's not much, but
Yeah.
the emotional
Yep. Yep.
aspect of it, it's so huge.
Yeah. Yeah. You're also talking about how uh like technology changes, but the field of medicine does not change as much. Um, so if but is there any research going on in or around nephrology that you have to keep up with just so that when you go see a patient, you can dial that in?
Yeah, good. There are a lot of interesting things going on in the field of nephrology. One, recently they transplanted a pig's heart in, I think, New York or something. So same thing is going on. Like they're working on artificial kidney, so artificial organ, xeno was like coming from another species.
Yeah.
There's some work going on mechanical artificial kidney using nanotechnology. So you will have kidney this big artificial implanted, so you will not have to go to dialysis center. There are a lot of things uh, going on a cellular level where you can target one cell instead of. So currently, if you give chemotherapy, that goes to
Yeah.
all the cells,
Yeah.
and that's why all the cells die you lose here.
Yeah.
So similarly, they're trying to focus that go on one cell, or
Mm.
whatever that particular cell. So that's going on in kidney as well. So
Mhm.
so when I said that, uh, so coming into practice takes time as opposed to other fields. So
Yeah.
you really have to have a rigorous research behind any new implementation. So a lot of new things comes, but at a slower pace. Like
It's slow.
every
Yeah.
months there will be one new thing.
That's okay. That's amazing. So about the cellular, how it focuses on one cell. I was just reading a few things just out of curiosity. Is it related to mRNA?
That as well. I mean, there are a lot of things. So one interesting thing what they are doing is that they will take your cells. So your T cells attack the tumor, right?
Yeah.
So they will take your T cell, amplify it in the lab,
Yeah.
um, and then put it back in use. So you will
Oh, okay, okay.
very,
Yeah.
yeah.
Yeah, that seems very interesting. Yeah. Um. Uh. I think that's about it. Do you have any advice for me, my high schoolers that are with me, and people who are just about to go into medicine?
You have chosen the right field.
Okay. Um, well, thank you for being here. It's been a pleasure. Um, so thank you guys for watching the video. I hope you guys learned a lot from this video. Um, if you guys want more videos, please like and subscribe. Also comment down which specialties you want me to interview next. Thank you. Bye-bye.